And boom. I'm not very good at this, by the way. Good evening and welcome to the Alternate Radio Show, broadcasting from somewhere in Santa Cruz County. Well, this is meant both. It's a bit of a giveaway. And I got new microphones. I got static on my I've got complaints from static. New microphone that has never been touched.
Am I picking it up?
You are picking it up.
Okay.
And my esteemed guest, my honored guest this evening, is the Santa Cruz County Health Officer. Is it officer?
Yes, exactly.
Officer, Dr. Gail Newel. She came on the show before, but I did it on Zoom, and not very technical, so I kind of made a few mistakes on that thing, pushed the wrong buttons up. But she's here in person. Thank you for coming.
In beautiful Aptos.
Isn't it beautiful?
Beautiful.
You didn't even complain about the traffic.
No, the traffic was really good tonight.
Was it really?
Yeah. It only took me 25 minutes to get here from Emmeline campus.
You got lucky.
Yeah.
So lucky. I sat there today for an hour. It seemed like an hour. But anyway, I really appreciate you coming on the show.
My pleasure.
And I think, you know, I talked about before, everything's been talked about. Well, what would you like to talk about? What would you like to discuss?
Oh, I'm so tired of COVID. So I would really love if we could talk about other things, but we probably should start with COVID.
I heard today that we didn't move. We were 1/10 of a percentage away from moving to the next tier.
That's right. We barely missed it. Big disappointment for me. So I actually went out this weekend. Actually, I ordered it on Amazon. It didn't go out, but I bought a yellow scarf to wear because
right.
I now, and you can see now I have an orange scarf on instead. But I get the information about our tier movement the night before, late on Monday nights. But it's embargoed until noon on Tuesday, so I'm not supposed to tell anybody. But
You tell the missus?
I do tell the missus, and I am allowed to tell health officials and some key leadership people.
Right.
But what I've trained people to do on Tuesday mornings is to look to see what color scarf I have on.
Oh, yeah, you give it away.
I do. Well, I don't give it away.
Yeah.
I'm not releasing official state information.
It's like a flag.
I'm giving them a hint, yes.
You're like raising up a flag.
I'm raising a flag. So I had to buy a yellow scarf in anticipation. I really thought we were going to be yellow today.
We've been doing pretty good. I mean, throughout the whole thing, we've been doing pretty good.
We've been doing really great. Yeah.
I'm pretty proud of you, what you've been doing, and what you've been through, and what the community's done.
What the community's done.
Right?
The community's been willing to think about their neighbors, and as a result, follow the social distancing requirements, wear their face coverings when they're indoors in crowds, and all of the things that keep our neighbors safe, especially the vulnerable people in our community.
Right. I got my second vaccine Friday.
Yay!
Apparently it's a bit of an ass kicker, so I'm just,
Oh no,
No, I'll be fine.
Yeah, you'll be fine.
And I've talked to some friends of mine that don't want to get back. I'm fine, I'm healthy, and they don't want to get a vaccine. What can you say to those folks?
Well, I understand people's concerns. The vaccines, well, first of all, I do want to say that it's not like the vaccine researchers just came up with this overnight.
Right.
In the last few months. They've been working on coronavirus vaccines for years and years. I mean, after all, the common cold is a coronavirus as well. So the vaccine companies all know that there's a lot of money to be had in the coronavirus vaccine world. They've been working on coronavirus vaccines for this family of coronaviruses for 4 years.
Right.
And so even though there weren't human trials, clinical trials going on, and not specific to this vaccine, this virus until the last year, it's not new. But all three of the vaccines available in the U.S., they're still experimental use authorization only because of that short period of time with human trials.
Right.
And so I understand people's hesitation. But it's a kind of vaccine that we've been using for a long time.
It's like flu shot.
Not new technology, very much like flu.
Right.
And the side effects, they can really wonk you
In the
sometimes.
first 24 hours. Maybe?
Usually it's in the first 24 hours, right? I can tell about my own experience getting the vaccine. I thought I did great after the first vaccine. I got Pfizer, and about 12 hours later, all of a sudden it was like I had a really bad flu. I had total body aches, chills. I did not have a fever. Took a couple Tylenol. I drank a lot of fluids. Put myself to bed, and I was completely fine the next morning. Could go to work and everything.
Your position, when did you take that position as a Santa Cruz County Health Officer? When was that?
I did that July 1 of 2019.
So it wasn't long, yeah.
So I really barely got my feet under me before January 2020 when this hit me.
So I've been for a long time, and Santa Cruz County Health Officer, you don't really talk about him or hear about him at all.
Right.
Right?
Nobody
It's just
knows
a pretty-
about public health and health
No,
officials
I
and what
mean,
we all do.
you're
and all
not
that.
talked about.
No, I was not
Mayors,
seeking fame and
supervisors,
notoriety.
City council members, they're all yelling at them,
Yeah.
right?
The elected.
Your position is like, I can do this gig, it's quiet, so, right?
Traditionally, it's retired physicians that do this job. And indeed, I'm retired from clinical practice, and I thought, well, public health is a really cool thing. I'm going to give it a try.
You became the figurehead.
The COVID queen of Santa Cruz County.
I'm proud of you for what you did.
Oh, thank you.
You know, I mean, I could just come on the air tonight and go, I'm very proud of what you did for our town and our county. I mean, for what you went through, what I heard you went through, nobody deserves that. You know, all you can do is put one foot in front of the other and do the best you can with what knowledge you have. Who knows? How much knowledge? Was there a handbook? When this came about, there was no handbook. There was no instructions, was there?
No, we still don't know a lot about this virus. We're learning more every day.
Right.
And a lot of the decisions that I made and my colleagues, they were about, we did the best we could with the information we had at the time.
I'm just sticking in the my little microphone here. So what I do with it, here it is, right here. It just improves it a little bit, which I didn't have in before. But I can still hear you. But what about a beautiful day we got today?
Oh, it's the best of Santa Cruz. This is the ideal weather.
Ideal.
And I love being in this neighborhood. This is where I first lived when I moved to Santa Cruz County in 2014.
Right.
And we had a little beach house right here on the beach where we could see the whales and walk out to the cement ship every day when the pier was still open all the way. And so it's nice to be here.
Are you going to stick? What's your intentions over it and what your position? Are you sticking around? Are you going to stay here?
I'm sticking around. This is planned to be our home for the rest of our lives, my wife and I. We came here for her work.
Yeah.
She's an OBGYN, an obstetrician, a doctor at Palo Alto Medical Foundation, and loves it there. Has delivered a bunch of babies here now in Santa Cruz as an obstetrician.
Yeah. And you have kids?
We have kids, yep.
Right.
We have 3 kids, and that's another part of our Santa Cruz story is we lost one of our children here in Santa Cruz.
I'm sorry.
To an opioid overdose, and so that's something we should talk about.
Yeah, right.
Yeah.
Because that's the we should talk about it because it's a big problem here.
It is.
Right.
Yeah, it's a really significant problem.
And how old was your child when he passed away?
He was 38.
Okay.
So he actually came to UC Santa Cruz for college at the age of 17, and with our support, his dad and my support, and he did very well here. He was an art major at Porter College, and had a really beautiful senior show. We have all of his art collection now at this point.
Perfect.
And after that, he went over to Expressions, arts and entertainment school over in East Bay.
Right.
And he worked in the film industry for a while, so we got to see his name on the big screen.
Very
he
cool.
did green screen work and all that.
Yeah.
But then he had a family, and he said, I've got to do something that's got a more predictable income. And He worked with my brother a little bit, who's a dentist, and said, I'm going to go to dental school.
Good for him.
And sure enough, he went into dentistry, got into dental school, and he was working here at Dientes and living with us at the time. And we knew he had struggled with substance use disorders, and he had been sober for many years, working the program. But, you know, part of being an addict, alcoholic, is that relapse is always part of the picture. And we did not know that he'd went back and found the same dealer he'd found in college all those years before, like 20 years before. And he was not shooting, but using heroin, smoking heroin, and got a bad batch and with fentanyl, and had a fentanyl overdose in her home. His little brother found him. It was devastating.
Must have been devastating for the whole family.
It was. And so at that point, I was kind of bouncing around between teaching for UC San Francisco, doing some research in preterm birth, and I'd been doing some work for Fresno County Public Health. And so when we moved here, I thought, what can I do with this experience to make a difference? And the health officer position in San Benito County was open. And I went there, and the very first day I was there, one of their beloved community member kids died in the emergency department of an opioid overdose. And I said, I know what I'm going to do here.
That's what you're going to do.
And I helped form their opioid task force with the blessing of the Board of Supervisors and funding from their community foundation, and it is thriving now, and we made a huge dent in opioid use disorder in San Benito.
Have you been able to do that here?
I've been active. Santa Cruz was way ahead of San Benito, so a lot of the work was already done when I got here, and much of it underway. But there's so much more to do here.
Yeah, for the homeless population. Is the money there for you to get help?
There's some money, there's some funding and grant work, but it's not just the homeless population. I mean, remember, my son was a dentist who was employed, working in a job he really loved, and part of a supportive family with working the NA program. We thought very involved. It's not just the homeless population. It's throughout our whole community that there's addiction.
We talked about
problems.
Andy Mills yesterday about the drug problem in this town, and it's just it's what's coming up from Mexico. It's what's coming across the borders. It's getting worse. This, like meth, for example, is getting worse and worse and worse, more and more dangerous.
Yeah, and after my son died, we found his journals, and we discovered that he started getting opioids from his patients because they'd bring in bottles and say, I don't need these anymore, Doc, what do I do with them? I'll dispose of them for you.
Right.
And then he started ordering them from Canada, the U.S., mail order. As a dentist, you could do that.
Yeah.
Then that dried up, and he started getting involved in the dark web. He got Bitcoins, started buying from China, having them shipped to anonymous mailboxes, even unused mailboxes in our neighborhood, turns out.
Addiction is so powerful to go through all the efforts just to get that fix.
Right. Yep.
You have to have a certain mindset to be able to go there.
He was
obviously intelligent. He was obviously an intelligent human being.
He was, and he continued to make art. And one of the things we found in his belongings after he died was a half-completed graphic novel about his addiction.
Yeah.
And one of the things that really stuck with me was that he talked about that he was in disguise as a white man in scrubs with a name tag that said he was a dentist.
Really?
That so many times he was pulled over for what should have been DUIs or various traffic infractions. Right. He was pardoned at several different pharmacies in town who just overlooked the fact that he clearly was writing fraudulent prescriptions. And he said, if I weren't a white man, a white male dentist, I would have been engaged in the in the
Yeah.
criminal system, and
Yeah.
maybe he would have gotten sober that way, though.
Yeah.
You know, he never had the chance to hit rock bottom before he died.
Right. What do you think will be in a year from now? Do you think? Any ideas? What's your crystal ball saying?
I wish I could say that it's all behind us and things look really great. They look really great right now. I mean, there's almost no disease in this county. And so much is opening up and so much hope, and it's great to be here with you in person and all of
Yeah.
that. But I think this virus is probably going to circle the globe a few years at least. That's what happened in 1918 with the Spanish flu pandemic.
Right.
It took 3 years for the Spanish flu to burn itself out.
So you obviously you're telling your staff and telling the community not to let your guard down. Just because I'm going to go get my second vaccine on Friday doesn't mean I can go, do anything I want. I still have to pay attention, social distance, right? Wear my mask.
That's right. Yep. So far, it looks like those of us who are fully vaccinated, so 14 days after your final dose, you're not quite there yet, but when we're there, it looks like they're very effective, not just at preventing serious disease in us, but in also transmitting it to others. So we know that vaccinated people sometimes, in 2 to 5% of the time, can still get the disease.
Yeah.
But when they get it, it's very mild, and often vaccinated people don't even know it.
Yeah.
So we were really worried about, are we going to be spreading it to other people? But it turns out that's not the case either.
Yeah.
So the big concern is this variant. The same reason we have to get a different flu shot every year.
Right.
This is the same kind of virus that mutates constantly.
So it's unlikely. The two shots that I'm getting, the Moderna shot, is unlikely to have another shot down the road, maybe.
Yeah, all these companies are working on boosters.
Boosters, I call them.
Yep.
Oh. Okay, I'm ready. I'll do it. I'm getting one.
So like the Giants, San Francisco Giants just announced yesterday. Did you hear about that?
No, what happened?
Yeah, they announced that they're going to have sections at their ball games,
Right.
where if you show your vaccine card, that white card, so
Yeah.
be sure to save it. If you show that, then you can go into the vaccinated section. And that means you don't have to wear a face covering. There's no social distancing. You can sit with anyone you want, as
Right.
close as you want. And they're going to serve you food and drinks. I
Really?
mean, you have to buy them, but you get your beer and your garlic fries,
Right.
and you can
for
eat them.
$30.
Right. Yeah, but that's part of the experience,
That's part of the
right?
deal, yeah.
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 And so then the unvaccinated section people, they have to be in clusters of households, sitting 6 feet apart.
Right,
They cannot take their face coverings off to eat or drink at all.
So those of you who don't want to get vaccinated, okay, I'm gonna get the best seat in the house at the Giants game. Well, probably future sporting events, I would imagine.
Not just sporting events. I mean, yes, sporting events, but also theater,
Right.
concerts. Yeah.
Wow. I felt worse for the elderly. The elderly have taken it, and also I've also felt bad for kids, for not being able to go to school and then having to wear a mask. I wouldn't want to be a kid and have to wear a mask and can't play. How am I playing and having a good time with a mask on?
You know, the kids do great with masks.
You think
They're
so?
so resilient. They
Yeah.
don't care about the politics of the mask. They do really well with the masks. Even the little 2-year-olds, they do really well.
Okay.
For the most part.
Have you had to deal with politics in in your position?
Is that a joke question?
No, it's kind of a
The
question.
whole thing's been about politics. Yeah.
I know I'm reading and listening and watching about the Republican Party and then that whole it just makes no sense to me.
Yeah, I wish it could be driven by science. I wish that we believed in science as a society nationally, and we've moved farther and farther away from that. The last presidential administration, right? If you say something loud enough, often enough, everyone will believe you, even if it's not true.
Right. That we took my opinion only, not your opinion. We took one step forward and about 55 back. and on the last administration. How's the new administration doing? Let's talk about the future a little bit.
Yeah, I think the new administration is doing really well. They haven't done a lot around COVID, except, to impose a face covering order on federal lands. So, but that's getting loosened up too. So, CDC today said, loosened up some of the face covering. But in California, that doesn't yet apply. We still are under state orders around face coverings, although the governor announced today that those are going to be lifted.
Were you under direct orders from the governor, or could you make your own decisions throughout last year?
I could make my own orders as long as they were not less restrictive than the state orders.
Did you make any?
I did make orders, yes, the infamous beach closures.
Well, I live right here on the beach, and it was. You see the patrol cars go up and down, and they couldn't. The masses were too great.
Yeah, at first it worked.
Yeah.
For a while it worked.
Yeah.
And at first, we honestly didn't know. There was a big study out of San Diego, an expert there who said, "Oh, I wouldn't go in the water. You get COVID in the water." So
That's crap.
But that was crap. That from the beginning,
I
you
surf
could tell.
every day.
Yeah.
With people. I've surfed with a friend of mine. He's completely scared of COVID. He knows he's not getting it surfing.
Well, even when I closed the beaches, I did not close the water.
No, you
so
didn't.
Surfers, you could still
Yeah.
get out there, and kayakers and swimmers and
Yeah.
all that. So, and the beach closures were never about getting COVID at the beach. It was about trying to keep tourists out of our community.
Right.
Because of the crowded restaurants and bars and stores and sidewalks and all of that. So that was the effort.
So the orange tier right now is still 25%?
For what?
For restaurants?
Yes.
25%.
I've lost track. I can't keep track of every detail.
We're not going to talk about COVID. We're going to look at the dolphin out. The dolphin are coming. See them?
Oh yeah.
They're hauling
I do.
ass.
Yep.
Yeah, there's a whole bunch of them right there.
Beautiful. In the wake.
You know what?
Right out at the wake out
my
there.
interview is
they're
being put on. My interview is being put on hold by the dolphin. Right?
Just as I'd hoped.
Let's see if I can get.
Can you get me a whale?
I'm
Can
trying to
find
get
me
you a
out
whale.
there? It's not quite whale season yet.
If anybody can see the dolphin out there, they're absolutely flying. They're flying.
There they are. Beautiful. It's a gorgeous day.
There they are, right there.
See all the way out to Monterey Peninsula. Beautiful.
So you said you're getting made dinner tonight by your wife.
Yep.
What's for dinner? Do you know?
I don't know, but we are paying penance for a trip we took recently, where we ate way too much good food.
Yeah.
Food we wouldn't normally eat, and so we're on a pretty low carb
You
diet
are?
now. So it's probably like chicken breast,
Yeah,
salad,
yeah.
and grilled veggies. But my wife has a fantastic garden, vegetable garden,
Yeah.
and so we get all our veggies, lettuce, everything straight out of the garden.
And you guys like to travel. You guys like to travel, right? I see you on Facebook taking a bunch of
Usually
trips.
we like to
right?
travel, right?
Yeah.
hmm So we usually we're big scuba divers.
Oh, you are?
Yes, but we're warm water scuba divers. We don't like scuba diving around here. We like going to Indonesia for
Yeah,
the most
yeah,
part,
yeah,
and
yeah.
places like that.
Been to Roatan,
Yes,
Yes.
fantastic.
right?
Yeah.
I'm scared of heights, so I won't go scuba diving. It scares the hell out of me.
Yeah, so we're booked. We had a scuba trip last year that got canceled, of course. And we will go, it's been rebooked for July of 2022. And we hope that we're going to be able to go. It's a breeding ground. It's a newly mapped area of scuba diving
Yeah.
in a remote area in the most eastern part of Indonesia.
So your ears are all good? Your ears are good?
Ears are good, yep. And we go on a liveaboard boat, so that should be pretty safe. But two things I'm worried about with that trip is one about, if we would get sick there with COVID or a
Yeah,
variant,
right.
despite vaccination, health care there. And then also, there's been some regime changes in the
Right.
government, and
Right.
they're not too hip on lesbians.
Really?
Yeah, it's pretty Muslim, conservative Muslim now, so they don't like the
There's
same-sex
plenty of other
couple
places
thing.
to go diving, though.
There's what? Plenty other places. Oh, yeah.
Plenty of other places to go
Oh,
diving.
we'd be happy in Hawaii, for sure.
Did you know that the average Americans gained 39 pounds during COVID?
I heard 28.
I read 39. I thought, wow, ka-ching, I'm under the... Let's just keep it at 39, shall we?
Okay, we'll just make ourselves feel better, right? Yeah,
Right.
I've definitely put a few pounds on
I
myself.
have too.
Yeah.
What do you miss? Like I miss my hot yoga class. I miss going to yoga and hot yoga. What do you miss? Do you really miss?
Well, I really,
What-
really missed hugging my mom. My mom's in Fresno. That was outside of that 120-mile travel advisory
Right.
radius, and I'm really trying to follow all the state guidelines and be a good example. So I hadn't gotten to see her for a long time. She's independent living, but in a senior community, and they had the gates locked. We couldn't get in.
Right.
March, though, after she got fully vaccinated, I
Wow.
went and gave her big hugs.
That
and
must have been amazing.
yeah, had a family gathering with.
It's all the protesters that were outside your house. It's all dissipated
For now.
for now.
Yeah.
So your deaf and no teeth dog is
He's keeping him away.
And so I didn't have a laugh at that. They told you to go get a big. Who told you to go get a big? You need to go get a big dog.
The sheriff. Yeah.
Sheriff
He
did.
wanted me to get a gun, a guard dog, and a security system. We did get the security system, so
Yeah.
our house is all rigged up
keep
and
looking at it?
alarmed
Did you keep
with
looking at
camera
it?
now.
Did you keep looking at it?
No, I tried not to.
Yeah.
I was too busy working.
Yeah.
Yeah.
You still enjoy your job? Still enjoy going to work?
Well, I'm beginning to love it a lot more again because I'm starting to be able to do some work that's not COVID.
Right.
And I mean, the COVID work is important, but I'm really happy now again to be doing a little family health work. My old love area of taking care of pregnant women and
Right.
kids, and I'm starting to work on the opioid issues and some of those other
Which is
things.
probably more necessary than the COVID, I would imagine. The opioid
Oh.
issues in this town.
Yeah, we'll save a lot more lives doing that work at this point.
Just driving around downtown, being down the last night at Chief Mills, and driving around today downtown. It's sad.
It is.
But it's not just here. It's like everywhere.
I'm very heartened, though, that it seems like we're coming up with kind of a master plan
Right.
for persons experiencing homelessness, and now Health and Human Services are working together with the county, and the county is starting to work better with the city. And we have this new housing guru, Dr. Robert Ratner, and he's joined our community and our team, and with a lot of experience in
Right.
addressing homelessness. So
How long have you been in the medical field for?
I started medical school in 1986.
What's your...
Yeah.
We always ask...
1982, long
82?
time.
Long time.
82,
What's
yeah.
What's your favorite decade and why?
Of my life
No, is in the medical field.
in the medical field.
And the second part of that question: is there a day day for you that you never forget
Oh, there's many days in my life I'll never forget.
in the
but
medical field?
the medical field. Well, my decade of training,
Mm-hmm.
the 80s were really phenomenal. In medical school and then residency training, and I did my residency training in Fresno at the residency program there is called Valley Medical Center, same name as one in Santa Clara, but
Right.
it was in Fresno. And at that time, we almost took care of, we took care of the entire undocumented population from the Central Valley. And it was also the trauma center for the entire Central Valley and the Sierras. So people were flown in out of the mountains and
Right.
from up and down the valley after trauma. So it was a fantastic teaching experience. My Spanish got really good. And I learned so much and worked with amazing people. We called it Valley Miracle Center.
Did
and
you
that's
really?
really how it felt.
Yeah, very cool. And here in our town, with the county and the city and the sheriff and everybody involved in public service, we have a very strong community right here. Would you agree? Would you agree not?
Absolutely, yeah. And most health officers do not have that kind of privilege. Most health officers are at odds with their electeds, and many are at odds with their sheriff and their county leadership. And
Kick the dog.
kick the dog.
Why you kick him? Give him a little
Nudged
shove.
him,
Give him a little
nudged him.
nudge. I'm mad at the dog, by the way, because he went for the trash this morning.
Oh.
So he's not exactly in my good
Are
graces.
you sure
right?
it was the dog and not the raccoons?
Trust me, I saw the
It
dog was knee deep in the trash can. He was up to his neck in
Oh yeah, he's in
and
trouble
then looked at me and went, "What's the problem?"
What were we talking about?
I forget.
How supportive the electeds
Yeah.
are. So yeah, fantastic. I've had so much support from county leadership, from my HSA, Health Services Agency Director, Mimi Hall, is like my partner in crime.
Yeah, I'll have to give her a shout one of these days.
Yeah,
Come
for
on the
sure.
show.
Chief of Public Health, Jen Herrera, and then our County Administrative Officer, Carlos Palacios. The legal team has been absolutely supportive. The sheriff, I mean, I have his personal cell number. That's who I called when the protester
You
came.
needed that number.
I needed that number,
You
yeah.
did, yeah.
And all of his deputies, they've
Yeah.
been absolutely fantastic and supportive. Yep, and the electeds, all the supervisors as well.
Well, I'm gonna let you go have dinner, but I want you. I want to thank you for coming on the show. If you want, I think the missus is waiting. It's almost 7 o'clock, so I better get home. And I hope I don't get to interview you again. I hope you get to go back under the desk and we never have to hear about you again. I mean, in a nice way, you know.
I think we're going to have some things to talk about.
You think so?
Yeah, I think
I
we're
gotta
going to
drag
need
you
to
back.
talk about syringe services
Right.
in the county.
Yeah.
About
You want to talk about that now?
we could.
Okay.
We could talk about also
I just don't want you to miss dinner. I don't.
Oh, no,
I don't want
it's
you to
okay.
I keep seeing the roast beef come out of the oven burnt.
Oh no, it's okay.
Okay.
She understands. One thing I'm really proud of that I think our community should know about is, we've been pretty good about getting medication-assisted treatment programs in this community, which by far have the best outcomes to treat addiction. So to be able to replace that heroin or that meth with something else that works,
Yeah.
that makes that person comfortable while they're working through their recovery,
Yeah.
it makes all the difference.
Right.
And it dramatically increases the success rates. But what was happening is that when people got thrown into jail, those were discontinued.
Right.
Or when they're in jail, they didn't have an opportunity to get started on that.
Right.
So we've been working now to get medication-assisted treatment, the medication and the support services into our county jail. And everybody who needs it has the opportunity to get on board now. And it's not just methadone anymore. It used to be just methadone, but now it's a whole list of medications that are available, and really committed and experienced practitioners who are working with the folks. And I'm so proud of that, because we can have continuity of care from throughout the experience, and then they can be discharged right into care on the outside, and have a more successful probation period as well.
That's amazing.
Yeah, and we're a pilot program for WellPath, the national organization that does our jail medical now.
That's amazing. I'm glad you told that.
Yeah, it's a big success story, and we're expanding it more. And
There hasn't been many success stories lately,
yeah,
especially with homelessness.
right.
Every time I talk to somebody about homelessness and come on the show, the word solution comes up, but there just doesn't seem to be any.
Yeah, there is some good news.
Yeah, that's good news
yeah.
within that. That's good news.
And I know there's a lot of controversy around syringe litter, and there should be. There shouldn't be syringe litter in our community, and it's a challenging and frustrating situation. But it's not the syringe exchange programs that are causing the litter.
What is it?
It is, people who are addicts aren't very good at taking care of themselves, much less their neighbors and their
Right.
neighborhoods. So the root cause is addiction.
Right.
But then we also need to have more opportunities for proper disposal.
and more folks who are charged with cleaning it up and know how to do it appropriately.
Do we have that coming down the road, do you think?
We do. There's more programs coming, and we're working closely with the Harm Reduction Coalition of Santa Cruz. The county has a program, and then there's this a nonprofit program as well that's funded with state funds, but they're independent, and we're working closely together, getting people into treatment, and really doing our best to work hard on this syringe litter problem.
That's fantastic. That's great news.
It is. Yeah.
People complained about needles in this town for a long time. Stepping on them.
And it's not going to get fixed overnight,
No.
but
there's a lot of people in this town that work under the scenes, trying to make it a better place. We all go about our daily lives and do our daily thing. There's a lot of people behind the scenes that try and make it even a better place than it is.
Yeah. So many volunteers out there picking up litter out of our forests and beaches, and that's where a lot of the concerns come from, because they're finding them when they're out there cleaning up.
Right.
Yeah.
Anything else you want to touch bases on?
We could talk about fire season coming up.
I know. That's been a problem. I mean, I'm on this deck. I see these people come down below in their motorhomes and have fun and let fireworks off.
Yeah.
You know, like I'm like screaming at them out here. I should get the hose. I've tried that, but didn't reach. But yeah, I'm struck by the fire. But how does the fire season involve you?
Well, we're already starting. The county is already starting to prepare, and the way it affects me directly is that I'm part of the leadership for the Emergency Operations Center that responds to the fires. And the reason that the health officer is involved is because there's real health dangers with inhalation of smoke and ash.
Yep.
And then there's health dangers when people gather in shelters, especially during COVID.
Right.
So you remember last year where we had 35,000 people in shelters during a COVID surge. Really frightening. And all of those shelters had to be staffed with nurses, largely from the county, and medical staff, health education staff, behavioral health to deal with the trauma. So we're in preparation now to deal with another fire season.
We got lucky. We had a little bit of luck on our side, haven't we? Do you think, as far as that situation where people didn't get COVID, right?
We did,
we
right.
Did?
You're right. We had a lot of luck. Really, the only folks that got COVID were a few of the firefighters in the firefighter camp.
Right. And I'm thinking also the homeless people, the population was not, it's just like, how the hell is that?
Right. I think I prayed hard enough, and that's
right?
my prayers were answered.
Right?
Yeah.
You know,
Yeah, the two populations I really lost sleep over during this whole thing were the inmates, because really they have no control over their lives and their social distancing ability and all of that. And then the persons experiencing homelessness and those communities, because again, very, very little control over their situations. Yeah, so we did well there as a community.
With all the stuff that you do, how do you organize it? You've got a lot of stuff on your plate, and you can't. I have a lot of stuff on my plate. I just kind of brush some off, right? You can't brush yours off. How do you deal with it?
Well, I have a good support team, and it's grown.
By the way, my Nikki,
she's administrative aide.
She's very, very good.
Yeah, she is.
Nice gal.
Yeah. And so when I started as health officer, we had about 90 people total in public health, and now we're well over 200, and we need them.
Yeah.
We need them for ongoing work with COVID, for vaccinations and fires coming up. Hopefully not fires, but
so maybe we can skip a year from the fires.
Yeah, that would be good.
When I was that night, that all occurred right here. I mean, this was I sat here and looked at the whole fireworks show. Then I thought, oh shit. That if it heads up into the obviously which it did, of course, the immense damage those fires were
right.
Tragedy.
Yeah, we were evacuated from our home here, and then my wife, we took our little Airstream we had down to the La Selva KOA, and we stayed down there. And it got really smoky there, and there was a fire at the KOA. And my wife could stay at the hospital and work. She could stay there and sleep there where there was air conditioning and clean air, right? But my kids and I were over at
Stuck in the airstream.
the Airstream right at the KOA, and it was just a 16-foot Airstream. It was too tiny, and our pets and all that. So we ended up going up to our place. We have a little ski condo up in the Sierras, and then that caught on fire. So we went from the CZU fire to the Creek fire, and we were evacuated from there.
Right.
So fortunately, we could come back home here.
Get chased by fires.
Yeah, 2020 was a tough year for me.
It's a tough year for you. How's this year turn out to be?
It's getting better and better every day. Yeah, lots of good news.
Lots of good news. Well, go enjoy your dinner. I won't take
Thank
any more
you.
of your time.
Thank you so
Thank
much.
you so
Pleasure
much.
to be out here on your
Really?
beautiful deck.
Yeah.
And,
Isn't it
lovely
beautiful?
Yep. Happy
Blessed.
to come back anytime.
Really?
Yeah.
Thank you so much. I really appreciate it. I'm going to turn
Thanks.
off all the machinery. So, who's coming up next? Oh, on Thursday night, Alex Cicero is going to be playing in Capitola at the apartment building right above the surf break there. Check that out. And Saturday at the Hook, Matt Masai is going to be playing with the whole orchestra. And that's going to be a great concert. So those two concerts, Thursday night and Saturday afternoon on the Alternate Radio Show.
Have fun, everybody. Be safe.
Okay, thank you.